So you've basically been dealing with some pain.
Been dealing with
Again.
a lot. Yeah, like what I was saying, it's just a lot personally, school wise, and then like physically not being good weighs a lot more when you're going through those things.
I bet.
Yeah.
What's going on? Like what's
School.
hurting?
What's
Like,
hurting?
What's hurting?
Oh, like
I know school hurts.
upper traps, shoulders, like a lot of like mid back stuff, as well.
Like here?
Yeah, like right
Do you think
there.
it's from school or like sitting at a desk or just did you just hurt yourself?
I think it's a mixture. I was pulling some boxes and I didn't stretch properly, so I think I pulled something, but also posture because like
Okay.
I've been noticing I've been
Do you feel
going
pain
like
up here?
not when you press like that, no, but I don't have as much range of motion in my neck as I usually do.
So let's. Is it more on the right side? Yeah, definitely.
Yeah.
You have more,
Yeah.
way more. So slowly
Yeah.
go to the left. You can see like you're basically fully see your ear on this side,
Mm-hmm.
and on this side, yeah, you stop.
Yeah.
Probably missing roughly 15-20%
Yeah.
of that range.
Yeah.
That hurt there?
A little bit.
Right there?
No.
And you feel it down into the spine, or do you feel it?
I feel it. It's more so it starts in the spine and then it goes into the muscles.
Okay.
If that makes sense. No numbness. No.
Okay. So do you think that is this more of like a sprain strain injury to you, or is this more of like a like actual like real bad injury?
I think the first. That's more
But-
so just. It's not. I don't think it's chronic. I think it's just happened.
Any shoulder blade pain here?
No.
When, as you know, but when somebody has some crazy stuff going on in their life and they hurt their back, like you're more in the acute phase with this.
Mm-hmm.
So we'll do some acute and some pain relief stuff and go right into it. So
yeah.
no, we'll waste no time today since you got a busy schedule, and I guess I kind of do too. You okay?
Yeah.
You're right there.
Yeah. Are you contacting the scalings there?
So I'm actually, I'm hitting the multifidus.
Okay.
In this position. I learned this in a different position. Like a lot of people like to work the multifidi in the laying down or the supine position, which is, it's not a bad thing, but it's a lot of strain. It's like a lot of, but I find that if I can just push the erectors away and then I go up to that roughly that 45-degree angle, like here, I can contact it, I can rotate, and then I can use the weight of the head and my body pressure, and then I can kind of scoop that here. Yeah. I can really isolate, and then the best part is like you're kind of comfortable here. Yeah. So I let it just kind of melt like with your breath. Yeah. And it's not really as much straining on my fingers. Just rotate a little bit. Got a few degrees, but not much. Yeah. Not much. So we're going to start here, gentle. Don't laterally flex all the way towards me. And then also, if you go this way and you start to feel burning or pinching, it's too much, I'm going to do a upper trap release here. Okay. So here, and slowly laterally bend away from me. Good. Can I come back? A lot of school right now.
Yeah, we also got new carpet at home, so that was a whole experience of basically moving out of the rooms.
Move out of one room section by section.
Exactly, yeah.
But people don't realize, like, it sounds easy, but when you actually take all this furniture here and you put 4 times as much furniture over there,
exactly,
it's like, oh, there's not room here. And you have to take things out to, like, sometimes lift these things. Yep. I'm going through that type of thing, but good thing I don't really have furniture in my house anymore.
Oh yeah.
But I'm painting the whole house.
Oh, you are?
Basically, before I go to work and after I come home. But I have to do it in a time where like I don't have those big floodlights. You okay there? Yeah. I know that feels.
That's a good stretch though.
But so we can kind of just show here, relax the best you can here. We're pulling this away. Okay. So you're gonna come here, you're gonna go across and down, and then pull your head that direction.
Oh, yeah, that's really tight.
You know what I found like really helpful for some localized stuff is like working some of the interspinous stuff. The interspinous ligaments and muscles. It's pretty helpful, but it's not really something that people go after very easily.
Okay.
And it takes like a little bit of skill to do it. And when I say skill, relax that. Basically, what we're showing here is in between each little segment, there are ligaments that attach this, and then there are little muscles on each side. So to open the space here, what we do is we open the space and then we can kind of roll into it. So I'll come here, but you have to really kind of isolate that motion here. You can't just go like this. Like you can kind of feel I'm rolling off of it.
Yeah.
But you'll feel like this. I'm holding.
Yeah.
Once I feel that open up, then I roll right in.
Oh, okay, that's super helpful. Yeah, I feel the difference.
So, because think about it like this: if I were pushing on your shoulder and you tip that shoulder forward, I'm kind of just shoving your shoulder up. But if you tip that shoulder forward and I kind of roll in, I'm rolling into the muscle without raising your neck. It's a real great, and you can do this cervical, thoracic, lumbar. I find that a lot of people just like really love it because it's kind of like it's pushing directly on the spine. We all know that when you have an unskilled provider, unskilled professional, unskilled girlfriend, boyfriend at home that's pushing on your spine and it hurts, like you're pushing on bone and that doesn't feel good.
Yeah.
But when you're kind of here and then like right there it opens and then I just roll through. It's a small roll. It's like literally that much. Just rolling right through.
And you're using just like the pad of the thumb? Okay.
As flat as I can, but rolling through it.
Okay.
Let's just move your head and neck again. That's a lot better.
Yeah. I do, I would say like it's more so like a pinch, but it doesn't radiate.
Where?
What the mid back?
Yes.
That feeling is more so
like here?
A little bit higher. Yeah, like there.
Like on the spine.
Yeah.
Okay, so this is another perfect example of what we just did. We can be doing it again.
Okay.
So here's a really cool way of doing this. You give yourself a big hug. So when you're doing this, right, to get flexion of the thoracic spine, people will do this. Then they go here, then they go here. But we want to isolate this. So how do we isolate thoracic spine flexion? I will pin my arms down on here, and a lot of times we'll do this. I don't want that. I want here, and then I'm going to push that way. Do you feel the difference?
Yeah.
Okay. You feel it there? So we start an extension, like so. And then I'll end in flexion. So I tend to end in flexion. That hurt there?
No.
Okay. So you'll feel the difference here. Flex, 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 and then I'm going to push.
Oh, yeah.
It's a lot more aggressive than if we do that. So now pushing it there.
Yep.
I'm kind of like slightly off to the side. I know that. So
that's targeting the right area.
And then cross your arms again. A lot of people will ask me in clinic, does it matter? And I'm sure you've heard this. Does it matter if the right side is over the left? No and yes. No, as a new person learning. Yes, if you want to learn how to control people.
Yeah.
Not manipulation of people, but like control people's mechanics.
Yeah.
So ready? I'm holding your arm. I'm gluing my ribs to the back of your shoulder. Look at how much control I have here. If you do the other side, I don't have it because now this is a little bit more loose.
Exactly.
And now there's slide and glide of this shoulder. So, does it matter? No. But if you want to get great tension, yes. So I'll grab here. That's something that you'll learn as you get more seasoned. But now you don't have to. You don't have to go that. Wait a couple years to learn that.
Yeah.
Because you can feel like I can really pull. So if I wanted to work your left side, right, I'd be grabbing the contralateral Sorry, if I wanted to work, yeah, I'd be grabbing the same side arm, ipsilateral. I'm standing on the contralateral side, but I'm pulling the ipsilateral.
Yeah, okay. I'm like imagining it in my mind.
So I'm on the opposite side, I'm pulling you across.
Mm-hmm.
If I really wanted to kind of pull you this way, it's so much easier to pull you this way than if I just pulled you this way.
Yeah.
It's not as much rotation. I will do the same thing here. Cross your arms. See?
Opposite, yeah.
Right.
Mm-hmm.
So it doesn't feel as much tension for sure.
Mm-hmm.
Every time you have a neck injury, you're going to have to work in some sort of upper trap, rhomboid, T-spine, mobilization.
Yeah.
Everything. Like, there's just no way.
Mm-hmm.
You okay there?
Mm-hmm. It's tight, like those TPs are tight, but...
And that's where, like, if you don't really know the musculature, or it's kind of hard to figure out which one is really tight and it's all just tight, you can do, I learned this from a guy who did myofascial. And if you want, you can do whatever you want, but he was like, just do this. Do 3 or 4 strips, grab some like lotion, 3 or 4 strips, one close to the spine, one middle, one lateral. Think about 3 runways, 1, 2, 3. Like all these erectors that run up and down.
Yeah.
Just go like this. And then you can, I would slide, but in my case, I'm not necessarily sliding. I'm kind of like just pushing on it, like where that tension is in the vertebra. I'm just rotating. I find this, by the way, like I learned this in school and it's been extremely valuable through my whole career. And it feels pretty good.
It does, yeah.
And so you can feel how like I'm just going from here to here to here. But I'm not going like on the side of the TPs and like poking in on you. One of the best things that we talked about is like just after you adjust them, after you work on their neck and let them relax. Yeah. Let them relax a little bit. Like I know we're all in a rush to see the next patient, you know, on the hour or on the half hour or whatever you decide to do, but build that into part of your schedule. And so if you're seeing somebody for 30 minutes, you finish the session at 27 minutes or 25 minutes, assuming they're already on the schedule and you don't have to book with them, right? But you finish at 25, 26 minutes and you let them relax a little bit and you give them a plan for what to do for the next part of the week and the day. It's better to do that so that they have a plan of action versus just like getting out of there and moving around.
Yeah, well, you gotta let the nervous system also accept whatever input you put.
It's really 100% that.
Yeah.
I mean, we all know what it's like to go from the gym to immediately go to the gym to like get in the car and go get showered and get ready to work. Like your heart rate and your nervous system hasn't calmed down, and sometimes you're like, I did something so positive for myself, and then you're like feeling it, like internally. You just feel more stressed. You're like, how's that helpful? Like, better to do a 50-minute workout, and then at 40 minutes, just cut it short and like just start deep breathing for like 5 minutes. So this is where I would do a little bit of scaling work here. Yeah. So your whole like right side of your multifidi, scalenes, upper trap, levator, rhomboid, complex, which is something you'll see all the time. Will come down in a minute, and that's where you can work on like cervical extension right now, or just get some. I mean, for you have more advanced knowledge, so maybe just 5-10 minutes of heat pack or recumbent bike, and just sweat a little bit, and then call it quits on in terms of. Let's clip this to you. Oh yeah. So much easier on that side. Okay. I heard like a pop outside too.
Yeah.
Okay. Alright, let's go into your side.
I wasn't gonna do that because he got arthritis. But
okay. Look up. Okay. You need more oomph today.
Yeah.
When you're early in your career, I'll tell you this for sure. Even if you take a job, you okay there? Good. That was easy. Wasn't loud, but it moved a lot.
Yeah.
How's your ankle?
It's better. There's still limited range of motion, like when you just fold it back like that.
I'm gonna just pulse at it.
Yeah, that hurts.
I know. So I'm gonna pulse and heart. So for everybody who's here watching this, you had a pretty nasty ankle inversion sprain that we treated, so go check out that video. You would not want to adjust it if she's already feeling pain on this. So what we're doing, and I could feel still some warmth there. You could adjust the tarsals and stuff here.
It does feel like
It hurt?
no, it does feel like it needs to be adjusted, but I've been doing more so just range of motion to help it out.
Here it goes. So I think at that point, you know, you gotta just keep doing the rehab.
Strengthening up.
I'd already moved. Oh, nice.
Oh,
So
yeah.
easy. This is an aggressive one, sorry.
No worries. Is that the psoas or the hip?
So, good question, because this is like a psoas fascial release.
Mm-hmm.
What I'm doing here is I'm giving you a LAD, long axis distraction.
Mm-hmm.
I am manipulating maybe an anterior hip, so like some of this is kind of raised forward, and I can also with this hand I can pull it down, and then with the top hand I'm shearing it up on the pelvis, so you get a huge fascial pull, so like that feels really good. But when I manipulate it with this, and then I'm kind of pulling it apart, it's aggressive. It doesn't look like. And then the one thing you got to be cautious of, like if you have a really good squeeze, adductor tubercle is going to bump up against yours.
Okay.
And that does not feel very good. So you always start off with telling the patient, like, hey, I'm going to be squeezing. If it's too much here, I need to know, because because you really want to pull this.
Yeah.
But you got to be careful, like if you're strong and maybe they're not, or maybe they have tender points.
Yeah.
Okay. Just release. Just relax for a moment.
Oh.
I would not be doing that on this one with what you have going on.
Yeah.
In terms of the pull, because it's still, what, 2-3 weeks?
Yeah, two weeks, yeah.
Yeah, so it's still pretty acute.
Yeah.
Doesn't mean you can't adjust it. Just means, like, if you adjust it, you as a provider have to understand that if there are any repercussions of that, is that the best interest? Is that like what you want to do? Do you want to pop people for the camera and for like what they want, or do you want to give them what they need? Will you need to be adjusted? Probably. But is that the best use of our expertise as a sports chiro today? Probably not.
Yeah.
Probably not.
And that's a big thing I've noticed, like just what you said. There's many times where it could become like a one size fits all, and like what you said, do what the patient wants versus what's right, and that doesn't give lasting results. At least I haven't seen that.
As long as you tell them that, you're doing your due diligence. If you say, hey, like, I have no problem doing that with you, Mrs. Jones, like, I don't mind adjusting you if we can tolerate it, but like, just so you know, that's not all you need. Yeah. That's fine. We're cool with it.